Good day, everyone, and thank you for joining us in this leg of Business World Insights presented by MSD in the Philippines as part of Get Well at Mercury Drug Diabetes Care Program. I am Sam L. Marcelo, Business World's multimedia editor, and I will be moderating today's discussion on how we can ensure that Filipino diabetes patients get access to quality healthcare and information in this digital age. Today, we are celebrating World Diabetes Day, an international movement bringing attention to diabetes across the globe. In today's session, we are joining that campaign by diving into the roles that the general public, the government, and the private sector should play in ensuring that Filipinos are informed on diabetes risk factors, management, and prevention. After all, it takes a village to manage diabetes. Joining us in this discussion are a few of the players in this diabetes awareness campaign. Let's call them on screen. Dr. Cecilia Jimeno of the Philippine Society of Endocrinology, Diabetes and Metabolism. Ms. Leyden Florido of the Philippine Association of Diabetes Educators. Ms. Hilda Saljay of the Philippine Pharmacists Association. And Ms. Nelly Calipo of Mercury Drug Corporation. Welcome, everyone. Okay.
Hi.
Let's start with diabetes care for Filipino families. According to the International Diabetes Federation, over 3 million are suffering from diabetes in the Philippines alone, and the numbers continue to rise. It is actually the fifth leading cause of deaths among Filipinos in 2017 based on data from the Philippine Statistics Authority. Just to make sure that we're all on the same page, I'd like to start this conversation by clearly identifying what diabetes is. I'm sure we've all heard the word diabetes countless times. Pero what is diabetes really? Doc Cecil, perhaps you could enlighten us. What is diabetes and what are the symptoms we should be wary of? What is the prevalence, the burden, the risk factors of the disease in the country? Doc Cecil?
Okay. Thank you, Sam, for those questions. So what I'll do is I will try to talk about each of the questions. So the first one is, what is diabetes? No? And right off, when you hear the word diabetes, everyone starts thinking about high sugar. And that's practically what diabetes is all about. No? It is a chronic, meaning long-term or a lifetime disease, for which the main problem is that we have high blood sugar. And why is it important, no, for us to realize that you have this disease? Because having a long-term or chronically elevated blood sugar, yung parating mataas yung blood sugar, is actually toxic to the body. No? It can lead to problems. And Sam asked this, what are the symptoms? That's important because many people with diabetes actually don't have symptoms. And they only begin to have symptoms once their sugars are quite high, or they already have complications. So let's talk about some of these symptoms. Realize that sugar is able to attract water, and therefore many people who have diabetes, they urinate a lot. Ihi sila ng ihi. So sometimes they complain of waking up in the evening. It wakes them up from their sleep. Or during the day, complaint nila, they can't even work because they have to pee very often. Kung minsan, oras-oras na naiihi sila. Sometimes they don't have those symptoms, but they complain of thirst. So they wake up in the morning very thirsty. And then sometimes they would complain of merely itchiness all over the body or even in the genital areas. Some may not have symptoms, but they notice that ants would be actually swarming dun sa toilet bowl or sa ihi nila. It's because of the high sugar again. Now, some people start to have some complications, and that's when they might complain of some blurring of vision, medyo lumalabo yung paningin nila. They have numbness or yung namamanhid, yung arms and even the feet, or even they complain of some wounds that don't heal up very quickly. So pwedeng yun ang mga signs and mga symptoms, or symptoms of diabetes. But again, I'd like to emphasize that the greater majority of people with diabetes at the beginning actually don't have symptoms. And that emphasizes the importance of screening. Yung kahit wala kang nararamdaman, if you have risk factors, no, you need to have certain tests done. And so I go to probably the next question of Sam, no? Sabi niya, tinatanong niya, what are the risk factors? Okay, so yung risk factors, ito yung mga characteristics that if you have them, it might make you more prone to develop diabetes or to actually already have diabetes. So number one here is age. As we get older, no, we become more prone to developing diabetes. So in the Philippines, actually at age 40, we already recommend screening for diabetes, even if you don't have symptoms. Number two, and we will talk about this very soon, is a family history of diabetes. This is especially for those in the immediate family, parents, grandparents, mga kapatid, no, if they have that, then certainly you have risk factors for developing diabetes. The others are lifestyle related. No? If you're not so physically active, if you don't exercise very frequently, if you're overweight or if you're obese, then yes, you have risk factors for diabetes. Among women, one important risk factor is having gestational diabetes. Ano ba yon? This is the transient or panandaliang diabetes habang nagbubuntis, no? So women who have this frequently have kids who are overweight. And that's a risk factor for developing diabetes. Yung isa pa among women, yung tinatawag na PCOS, polycystic ovary syndrome. And women with PCOS typically have irregular menses. So yung mga babae dyan, parang di mo maintindihan na tumataba ka and then you have irregular menses, baka you have PCOS, and that is a risk factor for diabetes. So marami talagang risk factors. Even having certain diseases like tuberculosis or even certain rheumatic diseases like lupus actually make you prone to develop diabetes, no? And isa na lang, Sam, before I end this long spiel, no? I'd also want to talk about the burden of diabetes. It is important for us to try to find out whether you have diabetes, no? Whether you have symptoms or not, because diabetes leads to complications. And kung hindi pa po natin alam, diabetes ang number one na dahilan kung bakit po maraming nadadialysis sa Philippines. Diabetes is also among the working population of adults, the number one cause of blindness, no? And finally, it's also the number one cause of amputations that are non-traumatic. Ibig sabihin, kung hindi lang po uso sa Pilipinas yung mga nagmomotor at saka yung mga accidents, yun kasi yung number one cause ng amputation, yung pagkaputol ng paa. Kung wala lang yon, number one sana yung diabetes. So diabetes is the number one cause of non-traumatic amputations of the legs, no? Kaya important po na ma-avoid or ma-prevent or ma-pick up ng maaga yung diabetes before we have the complications.
Okay, thank you, Doc Cecil, for that comprehensive answer. Medyo natatamaan ako because I'm pushing 40 and I have family history, so I guess I should see a doctor. So as a follow-up po, Doc Cecil, I understand that diabetes relates to genetics and other socio-economic factors. So how different po is diabetes among us Filipinos? And dahil nga this is genetically acquired, as a family unit po, paano siya maiiwasan, Doc Cecil?
Okay, diabetes is really a family affair, and that's why I was emphasizing that if you have a strong family history or a history in the immediate family of diabetes, have yourself screened. So paano siya maiiwasan sa family? Of course, if you have that family history, go have yourself screened. Kahit wala ka pang 40, if you have other risk factors, sa Pilipinas nga, if you just have one risk factor, kahit alin doon, you can already have yourself screened. It's probably justified to have yourself screened. Now, sa family din, if you already realize that you have a family history of diabetes, we need to start trying to influence everyone in the family, not only to get screening, but actually to have a healthy lifestyle, no? So we need to eat healthy food. We need to be physically active kahit na pandemic. And of course, we need to avoid all the different other lifestyle-related things, no, that can actually worsen our risk for diabetes. Like what? Like, for example, smoking in the family. No, let's try to avoid that. Or even drinking sugary beverages. No? Uso kasi yun ngayong pandemic kasi walang magawa, snack ng snack. So yun, those are some of the things that we can do as a family. Now, again, how different is diabetes in the Philippines compared to the rest of the world? And this, again, is very important. Medyo mas bata yung nagkakaroon ng diabetes sa Philippines. Notice I told you, get yourself screened at age 40, whether you have a family history or not. If you look at other countries, mas mataas sila, 45 years old, 50 years old yung routine screening. Sa Pilipinas, 40, because we also already see that in the guidelines. No? And then number two, we tend to develop diabetes at much less weight than our international counterparts. So kunyari sa America or in other countries, no, they need to be pretty fat to develop diabetes. That it's not this way in the Philippines. You just gain some weight and our risk for diabetes already increases. So that's what we have to keep in mind, no? That in the Philippines, it's very different in that sense, younger, less heavy. And maybe the only other important risk factor in the Philippines is that we're gradually changing our diet. No, apparently, in the surveys that were done, we eat at least once a day outside of our homes. This was, of course, pre-COVID. Hindi ko ma-imagine ngayon na we're all at home, how much food is being delivered to our homes. You don't cook food anymore, and the tendency typically is for us to eat less healthy foods, no, when we buy it outside. So those are some pointers. I'm sure that our other panelists, no, will be able to tell you a lot more, no, about all of these different all of those things, no, as to why Filipinos are a little bit different compared to our counterparts. So back to you, Sam.
Okay, thank you, Doc Cecil. So important po talaga to have a strong family support system. So we all have to commit to a healthy lifestyle. To you, Ms. Nelly, this question is for you po. How is Mercury Drug helping the community in ensuring the availability and affordability of care and medicines for diabetes patients?
Oh, thank you, Sam. Mercury Drug is present in every Filipino community, and as a company, we recognize the fact that the number of Filipinos being diagnosed with diabetes is growing. Kaya naman, pinagtutulungan namin ng pansin sa Mercury Drug ang pagpapabuti ng aming diabetes care services, most especially through the Get Well at Mercury Drug Diabetes Care Program. We are proud to say that our Get Well Diabetes Care Specialty Hub has been recognized as a first in the retail or community pharmacy industry. Ang Get Well Diabetes Care Hubs po ay isang one-stop shop section in some of our Mercury Drug branches na dedicated para sa mga pangangailangan ng ating mga diabetic patients. So nandiyan din sa amin yung ating mga trained pharmacies to offer free patient counseling. Pwedeng-pwede nilang lapitan ang ating mga suki para magtanong if they have question regarding sa pag-inom ng gamot at ilang basic na questions on diabetes. A lot of our pharmacists in Mercury Drug, including me, were trained by experts from PSEDM and PPHA para mas mapagbuti ang pagpapayo at paggabay sa aming mga suki on all relevant aspects of diabetes management. Right now, Sam, in Mercury Drug, we have 29 diabetes care specialty hubs nationwide. We have 11 in GMA, 2 in Luzon, 9 in Visayas, and 7 in Mindanao. And the good news is, Mercury Drug is planning to open more of these specialty corners so we can reach more Filipino patients. Back to you, Sam.
Thank you, Ms. Nelly, for telling us about your program and your specialty hubs. Moving forward po, let's talk about diabetes care in the now normal. We know na mahirap magkaroon ng diabetes with all the risk factors and complications. What more po during this time when there's COVID-19? Ms. Leyden, this question is for you po. Aside from the threat of getting the virus when patients go out, what are the other sentiments of patients in terms of seeking medical help during this pandemic? Nababawasan po ba yung mga nagpapa-check up, Ms. Layden?
Yes, Sam, totoo yan. Nabawasan talaga. Madaming doctor na nagsasabi that they less ang consultation. When we say less consultation, yung face-to-face consultation is lesser. But meron tayong tinatawag na telemedicine. They can consult the doctors using our technology. Pwede yun. Kaya lang may marami pa rin na gusto talaga face-to-face. Kinaugali ng ating mga pasyente, gusto pumunta sa doktor at gusto nilang makipag-usap. During this pandemic, we really try our best. Nasabihan sa kanila, wag po muna kasi kailangan po natin ng social distancing, kailangan natin to take care of ourselves because we know very well that our people with diabetes are prone to infection. Mas madali silang mahawa. Although, sabi nga natin, do not, parang wag mo bigyan ng stigma sila. Pero, syempre, kailangan natin silang pag-ingatan dahil mahirap nang magkaroon pa ng panibagong sakit. And we know that this is a chronic disease that we have to take care of this patient. And we really try our best to educate them. We are open to telemedicine, to telenursing, sabi nga namin, kasi because I'm a nurse, marami din inire-refer ang mga doctor, especially if they're going to start insulin, kailangan mong turuan, and kailangan yung face-to-face. But through our media, mga social media, nakakatulong din naman sa mga pasyente. Kailangan lang, alam nila kung paanong gamitin ng technology. Otherwise, yun ang mahirap eh. Technology is very important right now during this pandemic. But, sabi nga namin sa mga pasyente, nandyan lang po to support you. Nandyan po kami, our doctors, our nurses, our nutritionist, dietitian, our pharmacists, they're there to help them. Hindi sila nag-iisa. One thing also during this pandemic, we encourage the family to work together. Be one, help each other, listen to each other. Kailangan ang suporta ng bawat isa. So yun lang during this pandemic, Sam, kailangan talaga magtulungan. Kailangan unawain ang bawat isa. Patients should be there. Kailangan yung habaan ng mga pasensya. Kasi lalo na sa mga pasyente, yung adherence nila, yung during this pandemic, daming pagkain. Ang daming pagkain na hindi dapat nila kinakain. Tama? Kaya kailangan magtulungan during this pandemic. Start with our consultation, telemedicine is there. Kung hindi maiwasan, tumawag muna sa doktor at sabihin kung pwede silang makipag-usap sa kanila face-to-face. That's it, Sam. During this pandemic, we really have to do something about it.
Thank you, Ms. Layden. So, habaan ng pasensya, lalo na kapag mabagal ang internet. Just kidding.
Yes!
To follow up on that, I'd like to go back to Doc Cecil. Doc Cecil, Ms. Layden brought up telemedicine. Gaano ito ka-effective since it's crucial for patients to work closely with their doctors in improving blood sugar levels to reduce the risk of complications?
Okay, thank you, Sam. Actually, done well, it can be as effective as face-to-face consultation. But of course, marami talagang limitations, no? Sometimes the internet is slow. Many of our patients are not tech-savvy. And so, typically, actually, for me, mas mahaba pa ngayon yung sessions ko with patients than face-to-face, no? Because I cannot touch their feet, for example, but I can ask a lot of questions, no? And using their own cameras, I can take a look at certain parts of the body that need to be examined. So if done well and in cooperation with the patient and their family, it can be very effective. So kunyari, some of the things that I used to do myself, they have to do it. They have to weigh themselves. They have to take their blood pressure. Many of them have glucometers, and in fact, they can monitor their sugars. I've even been able to start a few patients with the help of our educators, our nurses, to start insulin. No, even just by demonstrating it to them through any means actually of communication, and probably that's important. Yung sinabi ni Ma'am Layden, no, ni Miss Layden, na hindi lahat ng pasyente kaya actually na mag-video consultation. And so we use all forms of communication. Sometimes they just call me on the phone or text me, some of them on my messenger, some of them on Viber. Any and all means actually of trying to communicate with patients for whatever will work for them, that will make the consultation more effective. And I've seen patients actually who started soon after the pandemic with high sugars, and they were just consulting with me on telemedicine. I've seen them able to improve their sugars even just through telemedicine. And probably the good news also for our patients is that our COVID numbers are gradually dropping, no? And so hopefully sometime early next year, we will be able to start limited consultations. But as of the moment, we highly encourage everyone, no, to do proactive consultation. Ibig sabihin, kahit wala ka pang komplikasyon, wala kang nararamdaman, please search for your doctors, contact their secretaries, find a means not to be able to get in touch with your doctors and have your consultations. Back to you, Sam.
Thank you, Doc. Okay, so face-to-face is great, pero kung hindi kaya, let's take advantage of technology. Any form of consultation is better than nothing.
Yes.
So, in terms of getting medicine, Miss Nelly, I know that Mercury Drug has a call order pickup service and that you recently launched your delivery service in selected areas. What kind of precautions po do local pharmacies have to ensure the safety of their customers, Miss Nelly?
Okay, Sam, the safety of our Suki is our priority. We have been diligently following health and distancing protocols in all our Mercury branches to ensure the safety of our customers. For instance, we do contactless payments in partnership with our e-wallet partners like GCash or PayMaya. Our Suki can also order online and pay as well online. As you have mentioned, meron din kaming call order pickup service wherein our Suki can conveniently call their favorite Mercury branch in advance to order and advise their preferred time of pickup. And recently, kaka-launch lang din namin ng aming delivery service in selected areas. And we also continue to monitor our social media pages to check any concerns or feedback from our Sukis. Back to you, Sam.
I'm glad you mentioned contactless payments, Miss Nelly, because during the peak of the quarantine, these mobile wallets have been really useful in our online purchases and bill payments. And you're right that now more and more people are using these apps to pay for everything from groceries to medicine. By the way, to our live viewers, we're dropping a link in our comment section later so that you can watch a short video and answer a quick survey by GCash and their online credit line, GCredit. We'll also flash a QR code and link at the end of our discussion. So, Ms. Layden, back to you po.
Yes.
During this time, how have you been promoting patient adherence, lalo na ngayon na maraming takot lumabas sa bahay?
Nako, yung adherence na yan. Nakakatuwang pag-usapan. Kasi tayo mga Filipino, I don't know, pag wala tayong nararamdaman, kahit meron tayong tinatawag na medication maintenance, we will drop it. Maraming gumagawa ng ganyan. So please, panawagan po sa lahat ng mga pasyente, lahat ng taong may diabetes, at doon sa pamilya nila, pag po kayong mayroong inireseta ang doktor, pag po ibubulsa ang reseta, dalhin po yan sa Mercury, bilhin po ninyo. At kung ano po yung nakalagay, sundin lang po yun. Kaya kung meron po kayong concern and siyempre financial, hindi mo mabibili lahat yan. Pero wag po ninyong ihihinto. Hindi lang po sa gamot ang pinapag-usapan natin sa management ng diabetes, meron pa din pong ibang management dyan, katulad po ng nutrisyon, yung pagkain natin. Ang lahat ng po ito ay individualized na tinatawag. Kanya-kanya pong pagkain, pero hindi kanya-kanya pong pagkain na preparasyon, ha? Pare-pareho pong pagkain, pero meron pong limitasyon sa bawat kinakain ng isang tao may diabetes. Hindi po inisesegregate family. It is a family affair. Hindi po sinisegregate ang pagkain nila. Ang kailangan po nila ay tamang sukat, tamang damit, tamang sustansya. Ang isa pa po na adherence natin sa treatment is yung exercise. Hindi lang po ito para sa taong may diabetes, para po sa lahat. Kasi sabi nga natin, ito po'y pangmatagalang sakit. At kung ito'y nasa pamilya na, maaaring hindi pa alam ng kapamilya niya na meron na rin siya. So, i-prevent, nabanggit po ito ni Dr. Cecil kanina, we have to prevent and we can prevent diabetes through adherence to management, through prevention, how to prevent, eat right kind of food, do your exercise. Ito po, during pandemic, tumataas po ang stresses in life natin. Medyo, makipag-usap lang po tayo sa ating pamilya. At kung masama ang loob, sabihin lang yung sama ng loob. Iwasan po ang so much stress kasi nakakapagpataas din po ng blood sugar. Isa pa rin po that you have to adhere to that management. At kung kayo po ay naninigarilyo, please, ihinto na po ninyo ang paninigarilyo. Yun lang po ang ipinagbabawal natin sa ating may diabetes. At sa pamilya na mayroon diabetes, yung pong tinatawag natin pagsunod, sundin po ang mga payo ng ating mga manggagamot, mga doctor, mga nurses, and nutritionist, dietitian. Adhere po dun sa ating management ng diabetes para naman po iwasan natin yung pagkakaroon ng komplikasyon. At nasabanggit po ni Doktora kanina, ang ikinamamatay po ng taong may diabetes ay yung komplikasyon. Ayaw po natin magkaroon kayo ng komplikasyon. We really wanted you to have a life na prolong natin without complication at all, and you have to enjoy your life to the fullest. Habang po nabubuhay, we have a pag-asa. And the pag-asa is with your family, and listen to each other, adhere to your management, prevent the complications of diabetes, and for those na wala pa, prevent the onset of diabetes, because diabetes is a chronic disease na pag nagkaroon po tayo ay hindi natin masasabing maaalis yan forever. May forever po sa diabetes, and that is your diagnosis of diabetes. Kaya lang, good news for that, kayang-kaya po natin ito i-control. We can do it, and you are not alone. Meron po kayong mga suporta with our healthcare professionals, with our family and friends. Kayang-kaya po natin labanan ng diabetes. Just adhere to your treatment. Huwag ihinto. Magsabi po sa inyong doktor kung gusto nyo ihinto yan o hindi. And you are going to talk to each other because kayo po ang nasa sentro ng itong gamutan. You are the center. Patient-centered po tayo. We have to listen to you because kayo po yung susunod. Kayo po yung masusunod sa mga gagawin ninyo kasi katawan po ninyo. We are here to guide you. We have to facilitate your treatment, and we are going to explain everything why you need that. And that is some, I think, for the adherence to management of diabetes. Back to you, Sam.
Okay, makinig tayo kay Miss Layden. Okay, please take your medicine, eat healthy, exercise, and huwag manigarilyo. Usap vaccine naman tayo. Doc Cecil, what are the types of vaccines needed by a person with diabetes? What is the role po of vaccines in diabetes management, and why is immunization crucial among people with diabetes, Doc Cecil?
Okay. So, unang-una, huwag kayong makinig sa mga anti-vaxxers. Hindi po totoo na maraming masasamang epekto ang mga bakuna. No? And in fact, the main reason why we give vaccines is actually to prevent diseases, to prevent what we call infectious diseases. So, halos lahat naman ng bakuna na kailangan ng adults, no? Kailangan din ng mga taong may diabetes. Pero meron tayong tinatawag na mga priority vaccinations. No? So, unang-una na dito, yung flu at saka pneumonia vaccination. Itong flu or influenza vaccine ay laban sa flu or trangkaso. Bakit? Ang flu po kasi is a virus. And ayaw natin, lahat naman ng tao, ayaw nating magkaroon ng any kind of virus. But in fact, pag nagkaroon po kayo ng influenza or ng flu, humihina kasi yung resistensya ng buong katawan, and it makes you more prone to getting other infections, including bacterial infections, including po yung pulmonya. So, di ba, parang weird siya. Bakit ka babakunahan against a virus? Yun po is so that you do not get simple viral infections, the simple flu o trangkaso. kasi pag nagkaroon kayo ng trangkaso, humihina talaga yung resistensya. And all the more for persons with diabetes, mahina na yung immune system, lalo na kung mataas yung blood sugar. All the more pag nagkaroon tayo ng viral infection. So number 1 po, flu vaccination, taon-taon. The other important vaccine is the pneumonia vaccine. No? So nowadays, 2 klase na yung pneumonia vaccine. So for some of you, kaya kailangan po makipag-usap sa doktor kasi ang magandang balita actually sa mga bagong pneumonia vaccine, 1 beses na lang yung bakuna, no? Pero paminsan-minsan meron talagang adult na kailangan 2 magkaibang bakuna. Ngayon, ano yung pneumonia vaccine, no? Ito naman para po hindi tayo magkaroon ng tinatawag na pulmonya, which is a bacterial infection. Bacteria naman siya. And again, ang bacterial infections po, ito maaari na namang maging komplikado. Ito po yung klase ng pulmonya na maaari tayong ma-ospital, no? Maaaring mahirapan huminga. Ito yung maaaring kuminsan kailangang ma-respirator. Pero kung ikaw ay may bakuna, hindi sinasabing hindi ka na magkakapulmonya. Yes, pwede ka pa rin magkaroon ng pulmonya, pero hindi ka makakakuha ng klase ng pulmonya na nakakamatay. So yun yung importansya actually ng pagbibigay ng mga bakuna. It's really for protection. And siguro yung isa pang napaka-importanting vaccination is yung sa hepatitis vaccine, no? Many adults, especially those with diabetes, have never had hepatitis B vaccination. At nakikita talaga yan sa mga pag-aaral na yung mga taong may diabetes, kung minsan ang dalas-dalas nilang magkaroon ng hepatitis B, lalong-lalo na po yung nag-share sila ng gamit. Kunyari yung pang-test ng blood sugar, yung glucometer, or dati nung araw, pati nga yung mga ginagamit na injections, no? Nag-share sila. So yun, being bloodborne, nalilipat sa pamamagitan ng contaminated blood, no? Maaari kang makakuha ng hepatitis. But if you protect yourself, then hindi ka mapoprotektahan ka para hindi ka magkaroon dahil ang pagkakaroon ng hepatitis ay maaaring makasira sa ating atay. So marami talagang iba't ibang bakuna, no? Hindi ko na babanggitin yung iba, pero ang 3 pinaka-importante talaga is flu vaccine, pneumonia vaccine, and hepatitis B vaccine among all persons with diabetes, especially the elderly.
Okay, so thank you. All right, so believe in science, believe in scientists, believe in doctors. Get yourself vaccinated. Thank you, Doc Cecil. We've seen a lot of technical advancements in various industries. In the medical field, we now have telemedicine, as mentioned earlier. Marami pang iba. These developments help patients manage their disease and provide them with more efficient and cost-effective healthcare. This question po is addressed to all. With all the technical advancements we have now and the forthcoming 4th industrial revolution, how do you see diabetes management changing in the next 5 years? Who wants to answer this?
Maybe si Miss Leyden muna, and then I can follow. Or you want me to be ahead?
Alam mo na, Dr. Cecil,
sige.
iniisip ko pa yung aking sasabihin.
Okay, so maybe I'll be ahead. And you can just add on to what I'm going to say.
Yeah.
So I think sa Pilipinas, no, just to give hope to our patients, lahat ng mga nangyayari internationally in terms of technology, dumadating sa Pilipinas, no?
Yes.
So we now have better drugs, and all of those drugs are available in the Philippines. We have better insulin even, no? Dati takot na takot lahat ng tao mag-inject ng insulin kasi ang hahaba ng needles, syringe talaga yung ginagamit. Lahat ng technology, yung mga new pens, shorter needles, less painful ways to inject ourselves, meron na po yan sa Pilipinas. Even po yung less painful ways to monitor our blood sugars, they're coming our way. Meron na po ngayon na yung tinatawag po na continuous glucose monitor. Ibig sabihin, hindi na po tayo kailangan mag-prick ng mga daliri natin. No? We wear a patch, and then meron pong parang cellphone that we put on the patch, and that monitors our blood sugar. All the technology is here. And I'm very hopeful that in the near future, with the introduction of universal healthcare in the Philippines, that our government will start to pay for some of these outpatient services. So matagal na po namin yung pangarap na hindi lang po magbabayad, for example, ang PhilHealth pag na-hospital. Ngayon po, in the coming UHC, maging yung mga consultations po natin sa doktor, even maybe some of the medicines, no, will be paid for by the government. Siguro sa simula, maliit na amount lang. But we foresee that to be gradually growing para hindi po yung nagagamit lang yung pera ng ating pamahalaan. For example, pag komplikado na, no? Siguro alam nyo lahat na binabayaran ng PhilHealth, for example, yung at least 1/3 ng lahat ng dialysis kung nagdadialysis tayo. Pero ang hope talaga namin is hindi lang mapopondohan yon ng gobyerno pagka medyo malala ka na. Mapopondahan ng gobyerno even yung outpatient care ng ating mga ating kababayang may diabetes, and I think in the future, even some of the medication. So yun po talaga, that's why we're very hopeful when it comes to diabetes treatment, because all of this technology is coming our way. Some of them are already here, and hopefully our government will also start to then gradually fund it. So we see that happening with universal healthcare.
Okay. Ako naman, Sam?
Okay.
Dadagdagan ko yung kay Dr. Cecil kasi tama siya, nandito rin technology natin, management of diabetes. Pero kami mga nurses, we're still hoping that the government will focus also on the promotion of health and prevention of disease. Kasi bigyan natin, pagtuunan natin ng pansin yung mga training and education ng ating mga healthcare professionals na pumunta talaga sa grassroots at tingnan kung paano mapiprevent this kind of disease condition, which is diabetes and hypertension. It's related. Lahat ng ito na related sa mga chronic non-communicable diseases. Sana magkaroon tayo talaga ng sapat na panahon, sapat na financial na bigay ng gobyerno para sa pagkakaroon ng program na talagang i-implement hindi lang by writing. Yung health promotion and diabetes prevention. Maganda kasing pag-usapan yung mga ganun para general public information, hindi lang basta at one time, big time na magsasabi na ito po ang dahilan kung bakit tayo may diabetes or bakit tayo may hypertension. Hindi yan. Kailangan po natin ay yung masusing pag-aaral doon. Lahat ng tao ay well educated about the prevention of this kind of diseases bago pa man sila dumating sa gamutan. Kasi ang nangyayari sa atin ngayon kasi gamot agad Nandun na sa level na may sakit na agad yung pasyente. Bakit hindi natin pagtuunan yung wala pang sakit para hindi na dumagdag pa sa bilang ng statistics na meron tayong hypertensive, meron tayong may diabetes sa pasyente at iba pang mga sa non-communicable diseases. And take note of this ito po ay generally, ang pinag-uumpisahan is unhealthy eating habits, our non-physical activity, hindi nagkakaroon ng tamang physical activity ang mga tao, increasing alcohol and smoking. Yan po yung mga common denominator ng mga sakit na yan Bakit hindi natin pagtuunan ng pansin yan? Maganda nga lang sa government natin ngayon, meron na tayong smoking cessation na law, di ba? Meron na rin tayong yung beverage, yung sugar content. Yes, napasa na yun. Sana lang sa implementasyon yan, sana matupad lahat. How I wish, and we really wish, yung pong nasa lahat ng diabetes societies, ang wish natin, health promotion, prevention of illness, and of course, sa management ng diabetes, nandun pa lang sa wala pang komplikasyon, ma-address na natin yung issue para wala tayong komplikasyon, para yung costs ng gamutan less din sa government. That is very hopeful at ginagawa naman po ng paraan. We have the UHC, Universal Healthcare, and sana, dire-diretso na ito. Di ba, Dr. Cecil, yan ang wish natin, ano?
Yes,
sana.
all the time.
Sana.
Yes.
Malaking
Miss
sana.
Nelly, would you like to add to that po, or should I move on?
No, no, no. I'll add. As for
Okay.
pharmacies like Mercury Drug, we've seen how our customers have adopted modern technology to manage their condition. Nariyan yung paggamit ng e-prescription and telemedicine, kagaya nung sinabi ni Doc Cecil at iba pa. And even with our own services, we've observed our suki are actively engaging with us on our digital channels, gaya ng aming website, social media, and mobile app. With this, we at Mercury Drug are intensifying our digital education and awareness campaigns on diabetes because we know that social media platforms enable us to reach more people who can benefit from reliable health information. And Sam, we believe that a well-informed patient can better manage or control his or her diabetes. Yes, Sam.
Okay. Thank you all. That's so good to hear na lahat ng advancements, lahat ng technology ay nandito. Sana nga maging mas mura through government support. Ms. Layden, you touched on this. There are a lot of campaigns bringing public attention to diabetes care. Ngayon, nandito tayo dahil sa World Diabetes Day. Aside from this global movement po, what are the other programs that raise awareness on diabetes prevention in the Philippines? Would you like to add po to what you mentioned kanina?
Okay. Kami kasi sa aming association all over the Philippines, lalo na ngayong panahon na itong November at saka July, we have what you call in July Diabetes Awareness Week. Pag November naman is World Diabetes Day. Talagang pinagtutuunan namin ng pansin at pinaghahandaan paano na ba namin marireach ang mga tao tungkol sa prevention of diabetes. And kung meron man is prevention of complication. Through our nurses group and our nutritionist dietitian, we're doing our best to create a program. Actually, we are encouraging our nurses, our diabetes educator to adopt a community. Kami dun sa association namin, we have adopted one community and we were able to develop yung tinulungan namin, ma-educate yung mga barangay health workers namin. Because sila yung nasa grassroots, sila yung parating kausap ng mga tao, parating kausap ng pamilya. Kahit wala pang may diabetes sa pamilya, tinuturo na nila kung paano ang prevention. Magtutulungan lang tayo eh. Yun ang kailangan natin is sama-sama tayo. We have to empower each one of us. Even we empower our family and the patient themselves para lang matugunan. Kasi kukunti lang naman kasi ang nagmamanage ng diabetes. Kukunti lang kaming healthcare professional na well-trained on diabetes management and prevention. Pero sa tulong ng mga tao na na-educate mo, may ripple effect yan eh, may continuous yan eh. Mula sa simula, mag-iisa ka lang, pero pag may na-influence ka na isang tao and you become so passionate in teaching these people, they really will be able to help themselves and they will be empowered in the prevention and control of diabetes. And we hope through this media, through this wellness program of Mercury, we can reach so many people. And we believe that Filipinos really are so, alam mo yon, madali silang maturuan, madali silang sumunod, mabigyan lang sila ng tamang kaalaman. Yun yung pinakang bottom line. Mabigyan ng tamang kaalaman so that they can have the right decision to follow. Otherwise, kung kulang ang kaalaman, madali silang ma-influence ng hindi tamang direction. So, well-informed people will have a quality of life. So, that's what I believe, Sam.
Okay, sabi nga nila, Ms. Layden, diba, an ounce of prevention is worth a pound of cure. So,
yes.
Salamat sa mga awareness programs. Ms. Nelly, back to you po. The private sector plays an important role in ensuring quality healthcare for diabetes patients. Could you tell us po what projects Mercury Drug is cooking up for diabetes patients? Perhaps you can tell us more about Get Well at Mercury Drug Diabetes Care Specialty Corners. How did Mercury Drug come up with this idea and what kind of reach do these specialty corners have across the country?
Okay, Sam. This year, Mercury Drug is celebrating our 75 years of service. Our priority has been and will always be the health of our Sukis. And we remain committed to provide patient-centered programs for our Suki. That is why we recognize the importance of interprofessional healthcare collaboration like this, together with BSEDM, PPHA, MSD, and other partners. We are able to bolster our efforts to provide Filipinos the service they need to help overcome diabetes. Ang goal namin ngayon is to expand the reach of our Get Well at Mercury Drug Diabetes Care Program. Kaya naman po, tuloy-tuloy din ang aming public education campaigns about diabetes sa social media where we tackle relevant topics from disease prevention, management, and even patient adherence. We also continuously train our pharmacists so they can continue to not just educate, but empower the patients to make the right decision about their health. Yes, Sam, back to you.
75 years. Congrats to Mercury Drug.
Oh, thank you.
To follow up, Ms. Nelly, how is Mercury Drug, as one of the leading pharmacy chains in the country, helping pharmacists provide healthcare sa mga suki niya?
Okay, for pharmacists interact with patients on a regular basis. So they have an integral role in advising patients about the safety and efficacy of their medications. That is why we continue to collaborate with experts for the training and upskilling of our pharmacists. We want to equip our pharmacists with essential know-how so they can address our Suki's commonly asked question about diabetes and provide patient counseling and support to patients. Sam, back to you.
Okay. So collaboration really is key.
Yes.
Kaya nga, it takes a village to manage diabetes. Thank you so much, Ms.
Correct.
Nelly.
Thank
So
you.
to sum up this discussion, I'd like to call all our speakers again for a closing statement. Could you please give a brief message to diabetes patients watching us right now? Doc Cecil, let's start with you, please.
Okay. So I hope that with this brief panel discussion that you have all learned something new. And more than just the knowledge, I hope that we have actually given everyone who is listening, whether you have diabetes or you don't, some hope about diabetes. I think ang magandang tagline dito na dapat nating tandaan is that the management of diabetes is bayanihan, hindi lang po doktor at pasyente. Marami pong mga tao who are working together, collaborating to make sure that we're able to address all of the different problems of persons with diabetes. Hindi lang po yung may komplikasyon, pero really to prevent diabetes per se, yung ma-pick up siya ng maaga at kung may diabetes, yung mapigilan yung mga komplikasyon. So hindi lang po doktor, hindi lang po pasyente, yung mga families po natin, yung mga loved ones natin, and different healthcare professionals. Right now po, even as we have this panel, may pharmacist po, meron tayong diabetes nurse educator, myself, and marami pa pong iba, mga nutritionists, and other healthcare professionals who are all working together with industry and with our national government to try to make sure that everyone gets the care that they deserve. So sana po lahat tayo, hindi kung may diabetes ka man at nakikinig ka, hindi mo feeling na you're alone, So we hope that you realize that there are many people who care for you, and that we are all trying to improve the lives of persons with diabetes in our locality and even in the entire Philippines.
Ms. Layden, kayo po?
Okay. Ang masasabi ko lang po ito. Ibukas po ninyo ang inyong puso. Sabihin kung anong nararamdaman. Sabihin kung ano yung pinagdadaanan. We are here to listen to you. You are part of the management of diabetes. Ikaw po yan. Ikaw po ang makakapagsabi sa amin at through your opening your heart and mind to us, we'll be able to tackle whatever, kung ano po yung nasa isip at dun po tayo magsisimula at magtutulungan upang mabigyan po namin kayo ng sapat na kaalaman, sapat na management or treatment to whatever you're having right now. Kasi kayo po yung mas makakatulong at mas nakakaintindi sa inyong pinagdadaanan. Magsabi lang po kayo, sabi nga ni Dr. Cecil, bayanihan po ito, magtulong-tulong tayong buhatin kung ano man po ang inyong burden. And last word ko po, cast all your burden to the Lord and the Lord will be the one to help you. Help yourself and the Lord will do the rest for you. And God bless everyone. Remember, you are not alone. We're here for you. Salamat po.
Okay. Sam, for 75 years, Mercury Drug's foremost priority has always been the health of our Suki. We pursue these diabetes care and awareness programs. We are committed to serving our Sukis in a relatable and understanding manner through our patient-centered programs. We are happy to take part of this World Diabetes Day celebration because we are one with our partners with our hopes to elevate diabetes care for patients through interprofessional collaboration. And I would like to thank Dr. Cecile and Ms. Layden for this collaboration. I hope there are many more. Back to you, Sam.
All right. Thanks, everyone. Bayanihan, tulong-tulungan lang tayo. Buksan natin ang mga puso natin. And now for our last speaker, we'd like to hear from Hilda Saljay, the president of the Philippine Pharmacists Association. Ms. Hilda, Ms. Gigi.
Thank you, Sam. Thank you for having me here to represent the Philippine Pharmacists Association to discuss issues and concerns about diabetes and the role of pharmacists in its management. So pharmacists have an important role in diabetes management, especially for those pharmacists in the community or in the drugstores and the hospital pharmacies. So every butika actually should always have at least one pharmacist on duty while it is open for business, and that's mandatory requirement in every drugstore operation. So during this pandemic, more than ever, pharmacists are the most accessible healthcare professionals in the community. And I would like to summarize the role of pharmacists in managing chronic diseases such as diabetes mellitus for this discussion into three. First, the role of pharmacists in diabetes treatment. Second, the role of pharmacists in health promotion, which include prevention and self-care. And thirdly, collaboration with other healthcare professionals. So first, with the treatment, this includes but not limited to assessing patients' needs and managing their medications. So it's included there, the patient education and counseling, medication use review, adherence program to improve patient outcomes, and also medication management for diabetic patients in multiple medications. So from product distribution, proper storage, handling, good pharmacy practice should always be in place, and up to proper dispensing and medication counseling. And that is to assure that the patient or the caregiver fully understood how to properly give the drug or take the drug. And in pharmacy, there are 5 rights in dispensing, and we always use this as a guide. We have the right drug, right patient, right dose, right time and frequency, right route of administration. And these are just basic. Now, this basic in this basic context, it is very important to really achieve this optimum outcome of the treatment. Otherwise, it will result to failure of treatment, and it will compromise, of course, the safety, and further will cause economic burden to the patients and the family. And secondly, pharmacists are in a position to provide, most importantly, health promotion, such as screening at-risk individuals, providing education on diabetes and therapy, and lifestyle modifications, supporting self-monitoring, lifestyle changes, and that is to identify unhealthy lifestyles. Pharmacists can help patients reduce risk factors by prevention through counseling, specifically medication counseling and lifestyle counseling as well, and that we could give when appropriate. For example, weight and diet management, exercise, and smoking. So para lang po sa kaalaman ng lahat, we pharmacists in the drugstores or in the community setting, we are the community-based knowledge resource health practitioners, and that we can help people or the patients understand the dangers of chronic diseases and the importance of prevention. And thirdly, interprofessional collaboration. That's our third role in the management of chronic diseases, such as referral to other healthcare professionals when appropriate. And pharmacists will work with other members of the healthcare team And we can refer patients' chronic diseases or chronic disease-related issues not to them. So additionally also, many pharmacists have trainings in diabetes education, and we have continuing professional development webinars or trainings in our association, and we give it to our members. The role and adherence to long-term treatments through the services offered can improve adherence to treatment, as these services target some causes of non-adherence. And this is the problem with side effects, lack of information about their condition, and the importance of treatment, and also lack of understanding of the seriousness of the illness. So all of this could be addressed, and we have a big role in managing the disease, no? Especially the chronic diseases such as diabetes. And also, there are a lot of innovations and new strategies that are becoming the trend, no, in the community and even in the hospital pharmacies or drugstores. Now, for those patients with chronic diseases, they usually have multiple drug maintenance, and adherence is usually an issue. So we have, as of now, we have telemedicine, teleconsult, call order pickup, or online ordering, no, from the drugstore, and delivery services as well. And there are other similar practice models which are starting to be available in the different drugstores to answer the demands of the time. And this should always be under the supervision of a licensed pharmacist, no, so that the quality of the products and services will not be compromised, and it should always be provided to the patients for a very successful outcome in the treatment. Now, diabetes, even if well managed also, can make it also harder for the immune system to fight infections. So patients may be at risk of more serious complications from an illness compared to people without diabetes. We all know that. So some illnesses like influenza can raise your blood glucose to dangerously high levels. People with diabetes also have higher rates of Hepa B, no, than the rest of the population. People with diabetes are at risk for death from pneumonia or lung infections. And so therefore, immunization is also a big factor, no, in the treatment of diabetes. And this provides the best protection against vaccine-preventable diseases. Now, in this context, pharmacists could also complement other health practitioners in adult vaccinations, especially those with chronic diseases. And we are already streamlining the pharmacy-based immunization training programs for pharmacists, and soon will be one of the value-added roles of the profession here in the Philippines. And as I have stated a while ago, PPHA, or the Philippine Pharmacists Association, as the leading organization of pharmacists in the country, we will be continuing to partner with all stakeholders, the government, non-government organizations, locally and globally, and other companies, now to better the practice of pharmacy and to position the profession on our expanded roles and value-added services in the health promotion, treatment, and interprofessional collaboration, especially on chronic disease management. And diabetes is just one. So needed now are models of practice which are evidence-based, consistent, and scalable, so such that the delivery of the treatment outcomes delivered or desired by all the stakeholders, by the doctors, all those involved in the treatment are successfully achieved. So I hope that we will be understood, that all patients, all stakeholders, and even pharmacists should now be informed on how would be the role of pharmacists in managing diabetes mellitus and all other chronic diseases. So with that, I would like to say thank you, and I hope that I was able to give a good insight on the role of pharmacists with regards to diabetes in the Philippines.
Again, a big thank you to our panelists, Dr. Cecilia Jimeno, Ms. Leyden Florido, Ms. Hilda Saljay, and Ms. Nelly Calipo. Thank you also to our partners, Mercury Drug Corporation and Olearn. And of course, our gratitude to everyone who tuned in to today's session. In a while, we'll be flashing a QR code and link to a short GCash video and survey about G-Credit. This is a GCash feature that allows you to access an online credit line straight from the mobile app. So check that out. For updates, please follow BusinessWorld's social media pages. Again, I am Sam L. Marcelo, and this has been Business World Insights. Stay informed, stay safe, and stay healthy.